everyone, and a very happy Wednesday to you. There is so much to tell you about on this day, starting with startling developments in Sierra Leone, my home country, where early on Wednesday, flames were seen and smoke billowing out of the prison complex there in the capital, Freetown. We will explain what this has to do with coronavirus in just a few moments, because we will have a live report for you from the capital itself. Stay with us for that. We're also going to be talking to a human rights lawyer, Sabrina Matani. She has actually been calling on the government of Sierra Leone for several days now. So before today's event, she'd been calling on the government to release prisoners in a bid to cut down the risk of coronavirus infections. She'll be joining us live. She'll give us her take on what has played out there in Freetown today and the road ahead. And also, this pandemic hitting every aspect of life, every aspect of society. We're talking about the health issue. We've talked about the economic problems. And as part of that economic challenge, we know that small and medium-sized enterprises are being hit particularly hard. The majority of businesses in Africa are, in fact, small businesses. They are feeling the pain at this moment. We're going to have a woman on this show who's doing her part to help entrepreneurs in need. Lots to talk to you about, lots of great conversations. Let's dig in. All right. I want to start by telling you about these startling events in the capital, Freetown, of my home country, Sierra Leone. On Wednesday morning, flames were seen billowing out of the prison, which is known as Pademba Road Prison, there in the capital. Flames coming from buildings that had been set on fire by prisoners who had staged a riot, in effect. Setting fire to buildings, the situation escalate, and then the sound of gunshots. We've taken a video that is widely circulating online right now. Take a look at the scene.
Of course, this is not the correctional center. Remember who don't find now the jail man in the try for escape. Somebody in a fence and shoot some, go down back. So a lot of soldiers and surround the prison currently, but the fire still inside the building. Fire still continuing for blaze. So
first of all, let me just say you can hear the sound of a child crying. That is not your imagination. There is indeed a child crying in the background of where our live reporter is standing by for us in Freetown. We're bringing you the show, this is unvarnished. We're bringing you the real story as it's unfolding. And so bear with us. There is a child crying, but bear with us, because to focus on that video, you saw the smoke billowing. There was a voice narrating scene, setting out that it is the main prison complex there in the capital, and that prisoners had tried to escape, according to this voice on that video, and saying that shots had been fired, according to the person who was narrating that video. I want to play a second set of images for you, which gives you a different vantage point on what was playing out in Freetown. Take a look at this. All right, so you heard the sound like gunshots. You heard the voice on the video saying live bullets. These are videos that are widely circulating right now on social media. You also saw the look of panic of Locoh, some of them even beginning to run, to move away from where you could still see the flames burning at the prison. Let's go right now to Freetown and get a sense of how this started. Journalist Thomas Dixon is there in the capital. He's with local TV station AYV. They were on the scene as much of today's developments played out. Thomas, welcome.
Yeah, welcome.
Good to have you with us. Welcome to the show. Let me start by asking you, essentially, what started all of this at the Denver Road Prison? Talk to us about how this all began.
You know, like you saw from the video, it all started in the early hours this morning when we heard of a riot at the Denver Road Correctional Center. You know, this center is hosting over 1,000 inmates, which is far more than the actual capacity for which it was built. Before this time, there had been rumors about people, or inmates to be specific, trying to find their way out. But like the government initially, they didn't take it serious until today when it happens. And when we get to the scene, there are a series of information from both the inmate and the correctional officers. According to the correctional officers, they said this inmate had wanted to escape, and in that process, they set the administrative building ablaze, which burned down some of the structures like the workshop, the kitchen, and the store. And from other quarters also, we heard that, you know, there are top political figures currently at the image from the main opposition, APC, which include the former Minister of Defense, Alfred Paulo Conte, former Mayor of the Freetown City Council, Albert George Williams, and another former military officer, Amadou Quaita.
So let me stop you there just so I can help our viewers follow along. So let me pick up the first question that I have, which is, you said that there had been kind of, from what I got, you're saying there had been rumblings or rumors that there might be a disturbance at the Denver Road Prison before this happened?
Yes, there has been a rumor. Like I said, on 1 month ago, on the 28th of March, the new Inspector General of Police, Ambrew Michael Sovla, paid an unannounced visit to the Denver Road Correctional Center, where he discovered 35 mobile phones with inmates. And when I spoke to him by then, he said, according to what he gathered, was that the inmates there are communicating with their relatives and friends outside, which prompted him to pay the unannounced visit, where he discovered 35 phones.
Okay, so there was that element of about a month ago that emerged. You also made reference to the fact that there are a number of opposition politicians who are currently being held in that prison. Let me ask you, there's talk of, at least that we've heard and seen reports and people saying that prisoners were shot during this riot. Is that something that you can confirm?
Yeah, when I went there, because I was at the scene when the riot took place, what I saw was tear gas and canisters were fired. But the norm before this time, wherever there is a riot, people see soldiers and police having guns. There is no way they can say there was no live bullet fired. There was tear gas and canisters fired.
You heard the shot?
I had gunshots, but I can't confirm whether it was a live arm or a tear gas. But what I can confirm was that I saw prison officers that was beaten and stabbed to death by the inmates. And the name of the prison officer is Hassan Kamara. As we speak now, The remains of the officer is at the Connaught Mortuary Hospital, awaiting post-mortem.
So this clearly was do you know how many prisoners, how widespread was this? Was this, I guess you could call it an uprising, effectively? How many prisoners? You said that this is a prison that has, if memory serves me right from what you said, at least 1,000 prisoners from...
Over 1,000. Over
1,000 prisoners. Do we know, do we have a sense of how big this protest was?
The protest was very big. Like I initially said, they are trying to escape. It was an attempted prison break. In my presence, one of the inmates almost get his way out, but he was outsmarted by the military and the police personnel who caught up with him and arrested him back.
Have we heard from the government? Any statements being put out?
Yeah, according to the Minister of Information, the issue caused the damage economically to the structure, the infrastructure of the prison.
But no information about loss of life or injuries or, live ammunition, no details given by the government?
There is a casualty, but as it is now, it is at the preliminary stage. The only death that was confirmed was the Hassan Kamara, the prison officer. There are also another death of some inmates, but the figure we can't tell as at now.
Okay, and is the situation under control now? Are authorities fully in control of the prison now?
Yes, it is fully under control. And as we speak now, an investigation is being mounted as to who are behind the riot.
Okay.
As we speak now, CID have set up a team that are going to investigate.
Okay. Well, Thomas Dixon, there in my home country of Sierra Leone with all the familiar sounds in the background. Thank you so much for joining us and giving us your first-person account of what you saw there as this disturbance, this uprising broke out at the Pademba Road Correctional Center, which we all commonly refer to as the Pademba Road Prison. Thomas, thank you so much. Appreciate it. Thomas Dixon there with AYV TV, a local journalist there in Sierra Leone. Thank you so much.
You're welcome.
So just to recap some of what we learned there, indeed, there was this riot. We've seen the pictures. We've shown you the flames that were billowing out of the prison complex. A number of structures set on fire, as said by Thomas Dixon, their local journalist, by prisoners who were trying to escape. And in the process setting fire to the workshop, the kitchen, the store, a number of buildings within that prison complex, trying to make a run for it. Prison officials, he mentioned military as well, descending on the scene, shots fired, shots which Thomas Dixon, a journalist there in Freetown, himself heard. There are reports of casualties among the prison population. He was not able to confirm that. There are rumors, but no confirmed numbers. But he did say that the prisoners set upon a prison official, someone within the administration, and that a man lost his life. A man called Hassan Kamara was set upon by officers and beaten to death. But the situation now at the prison, according to Thomas Dixon, the situation in that prison is now under control. And an investigation has been set up to look into this. It is worth saying again what he started off his report by sharing, which is there had been a rumor about a month ago that something was going to happen.
Sorry for interrupting. I'm Thomas S. Kebbe. This is not Thomas. Yeah, Kebbe. This is not Dixon.
Thank you absolutely for sharing that. Thank you.
Yeah, you're most welcome.
Thomas S. Kebbe, they're saying that there had been a rumor that something was going to happen. This is the joys of live broadcasting from the internet. That there had been a rumor and that he had heard about the situation and things being uneasy at the prison. I want to go right now back to Freetown but this time to bring in Sabrina Matani. She is a human rights attorney and also the co-founder of Advocate, which is an organization working to secure justice and empowerment for women in Sierra Leone's criminal justice system. I misspoke. She's not in Freetown. She's there a lot. She's actually in London right now. And I'm pleased to say that she joins us to give us her perspective on all of this. Sabrina, a warm welcome to the program.
Thank you so much, Isha. Honored to be here.
Listen, talk to me about your reaction. We'll get into the nuts and bolts, but let's just start with your reaction when you heard that something had gone down, something was unfolding at the Pademba Road Correctional Center, Pademba Road Prison in Freetown earlier Wednesday.
It's really tragic. I was so dismayed to hear exactly what you've been hearing and the pictures we've been seeing. It's something that civil society groups for over a month now have been calling on the government to release prisoners. I mean, across the world, not only in Sierra Leone. Overcrowding is rife in prisons, particularly on the continent. If we look at Pademba Road, I first visited Pademba Road in 2005. It's a prison that was built in 1914 for about 200 to 300 prisoners and now has over 1,500. So all the things that we are being told to do to protect ourselves from COVID, to social distance, to try and, have good hygiene, access to healthcare, it's very difficult for prisoners to do that, particularly in overcrowded facilities. So civil society groups have been calling on governments to release prisoners, those who are low risk, those who are elderly, those who are pre-trial, who haven't been charged yet. If we can try and make sure that prisons are not these hot spots, that prisoners can actually take measures to protect themselves, this will help to prevent exactly what we've seen today. And so I feel really dismayed at what has happened.
So you have teams on the ground, I know. What are they telling you about the spark for this? Because I just want to try and clarify and see whether you're getting any other information, because what we learned from the journalist previously, Thomas Kebbe, that this is something that had been rumored, that there had been inklings that something was uneasy in the prison and something might happen. Do you have any sense from your team on the ground as they speak to people that this was directly related to fear of coronavirus and the pandemic?
I mean, I don't want to speculate, but all I know from people that we've been speaking to prisoners and correction officers is that prisoners are scared. Yesterday somebody was diagnosed within Pademba Road as having COVID, and then I understand that there are more restrictions put in place in prisons, and prisoners are frightened, which is understandable. I think we would all feel that way. And it's important to note that this riot is not unique to Sierra Leone. We've seen riots in prisons across the world due to coronavirus fears in Brazil, in Colombia, in Italy. Just on Tuesday in Peru, there was a riot, and I think 9 prisoners were killed. So this is something we're seeing across the world because people in overcrowded facilities, where now they're having even more restrictions and they lack access to hygiene, they lack measures to protect themselves, are scared. And these are hotspots.
You made the point a month ago, you started the call, not just in Sierra Leone, but in other places, release low-risk prisoners, let them out to reduce the risk of spread of infection. In Sierra Leone, what was the reaction from the government?
I mean, I have to say that I think Sierra Leone has taken some excellent measures. I was in Sierra Leone in March and I'd come from the UK where there were cases and no one was doing anything at the airport. Sierra Leone was putting in place measures. So I think the government response has really been good. However, I think it's been a shame that we haven't seen Sierra Leone acting like other countries on the continent in terms of releasing prisoners. In Ethiopia, they've released over 5,000 prisoners, Kenya over 5,000, Morocco over 5,000, Senegal over 2,000. We're seeing a big wave of efforts across the continent and indeed the world to reduce overcrowding in prisons. I heard today that 200 prisoners across Sierra Leone have been pardoned as part of the Independence Day pardons. This is a really good step and I really commend the government, but 200 is a really small amount. We really need to get prisons down to capacity. And I think Sierra Leone has 2 options here. It can either clamp down hard on prisoners, can make sure that there's no external access from human rights groups, and really respond in a very punitive way. Or I think Sierra Leone can take a different route, and that's the route I hope they will take. I think they can still try and look at who is this prison population, try to decrease it, particularly those who are low risk, those who have underlying health conditions, pregnant women. A woman just gave birth today in a hospital facility and she's going back to prison. These are not people we need to keep in the correction centre. And Sierra Leone has been held out as a country which is really a model for justice. It has one of the most progressive legal aid acts on the continent. It's done so well. So I really hope that Sierra Leone will take the second option and continue to press forward in terms of justice and reforms, and try and reduce the numbers of people in prison, because this is not just about protecting prisoners, it's about protecting prison officers. And my heart really goes out to the family of all those whose lives have been lost today. But it's also about protecting communities. COVID doesn't respect prison walls. So if we see uncontrollable outbreaks in prisons, this is going to not only claim the lives of prisoners, but prison officers and their communities. And any deaths are not good. We're trying at the moment to prevent deaths due to COVID, but deaths due to violence are also not acceptable. And so we really need to do what we need to reduce the overcrowding in prisons. That's like the number one solution. That doesn't cost money. It doesn't take time. We can do that easily.
So what's the next step for you and your organization as you continue to pursue this aim, considering the fact that time is of the essence right here?
Well, I have to say, it's not just Advocate. I think there's many civil society organizations in Sierra Leone that are trying to work together with the government. We're allies. We're working in this together. We have the same objectives. And so I think many civil society groups will be continuing to engage the government to see how we can facilitate prison releases. And again, I think that a key call will be that access needs to remain. The UN has called for, governments to make sure that human rights bodies, so even, the Human Rights Commission, it's really key that we don't close down these prison walls and nobody knows what's happening. It's really important that at least even institutions like the Human Rights Commission can continue to go in. And I'll just reinforce and say, Aisha, that these calls are made by the UN. It's WHO. It's the African Commission on Human and People's Rights who are saying we need to release prisoners. It's not just civil society groups. It's a global call.
Yeah, absolutely. One that we hope that governments all over the world will hear. In terms of access to prisoners right now, what is that like during this time there in Sierra Leone?
It has been more restricted because the prisons are trying to, keep people out. They did allow the Human Rights Commission to go in recently, which I think is really positive. And, we've had a very positive relationship with prisons. We continue to work with them where they need supplies of hygiene materials. We're still able to give them. So, the prison service has a really good relationship with civil society organizations. And I really hope this will continue. And let us not let this riot and what happened today, which is so tragic, to lead to more deaths in future by stopping this sort of assistance and collaboration with civil society groups. It's so fundamental. I mean, the prison and the government are overwhelmed right now. They need all the support they can get to work together to make sure that COVID is reduced in the community, in prisons, and we don't have any more of these kinds of riots and violence and deaths that we've seen today.
Yeah, I couldn't agree more. Sabrina Matani, thank you for the work you do, that you've long been doing, and for coming on the show today. We look forward to getting updates from you in the days and weeks ahead. Thank you so much. Stay safe.
Thank you.
You heard from Sabrina there that, the call is for prisoners who don't pose a threat to society, who are low risk to be released. Again, giving us some context that Pedemba Road was created or was set up to hold 200 to 300 prisoners, and currently has over 1,500 people there in that complex in the capital, Freetown. Making the point there that it is not just Sierra Leone that they're calling for change and this release. It's a global call all around the world that governments are hearing and be called upon to release prisoners in an attempt to reduce the spread of coronavirus. So we're going to stay on top of it for you and all those details. Okay, so as you can see, this impact of coronavirus is just it's multifaceted. It's multisectoral. It's hitting everything. When it comes to the health sector, I think healthcare workers are being tested in unparalleled ways and at a scale that we've perhaps never seen before. In Africa specifically, the fragile health systems have long been known, and attempts to strengthen them have been uneven. So we've seen, that stark differences remain, the differences in healthcare between Sierra Leone, which we're just talking about, and a country like South Africa. The difference is vast. But in recent years, there has been an attempt to strengthen capacity, to expand it. And that effort has been led by Africa's CDC, in which they have set up, partnerships to train the next generation of healthcare professionals. Our next guest has been part of that effort, Dr. Scott McNabb. He joins us now from Atlanta. He is a public health expert, and he's at Emory University. Emory is in Atlanta, but he actually joins us from North Carolina. And he joins us to talk about these efforts. Welcome.
Hi, Isha. Thank you so much for inviting me.
Pleasure
to be here.
It's so good to have you with us. This is important work you've been doing long before, at least a significant amount of time before this pandemic broke out. As you look at the situation, though, right now, just, broad strokes before we dive in, what is your sense of Africa's level of readiness to deal with this pandemic?
Well, I actually have some good news. It's wonderful to work and serve and support the new Africa CDC, which has been in existence really only a little over 4 years. And Dr. John Nkingason, who's the executive director, is doing an amazing job. He's a fantastic leader. And so it's really a pleasure to serve and support the development of what we call an Institute for Workforce Development, using modern online e-learning to sort of expedite training for public health professionals like epidemiologists like me, and laboratorians, and also informaticians. So we last year offered 4 courses, online courses, which across the continent, 55 countries, 1.2 billion people, equally represented in this institute, which is moving to the next level. I gave a seminar at Emory where I was talking about so I see is moving into the ever quickly. So we established community practice. We do an there for this professional facility
information going to have with your audio. Let me give you some comments as they've been coming in, and share what you so far. A couple of comments, writing information, get sorry, the second team. How does it? Okay, I'm going to proceed. So, Dr. McNabb, you were saying that you have these different platforms that you're using to convene health professionals, and get a sense of what's right now on the them up. Right now, with professionals there.
what we first which is communicating from physicians who've had experience. Last Thursday, from New York and Seattle, communicating their experiences to the Africans, which gives them a sense of respect. Then we have a group chat, Telegram, where people can talk about best practices, talk about issues, they want to share questions. We also have a place full of one-stop shop of access information, live feeds, talking to the WHO, and also access information, scientific-based information, if they have any questions.
Okay. What kinds of questions about?
Well, for example, what type of mask to wear? How do we deal with patients and protect our own staff? In prevention and control. Questions about, clinical findings. What are the findings? How do we diagnose the patient? When do we move a patient to the level? All those very important clinical discussions and decisions that physicians have to make.
I mean, when you look at the situation now, especially when it comes to response to this pandemic, obviously we spend a lot of time talking about the testing and how essential that is, testing, isolate, contact trace. To do that contact tracing, it's going to require an all hands on deck approach. We're going to need to get community involved. Talk to me about how you see it and the attempts to scale up and train people in the time, which is not a huge amount, to be ready for this. What's the effort? What's the plan?
Well, certainly the plan is to make sure that accurate scientific information is presented. There are a lot of misinformation that's being distributed now on various news sources and so forth. So we try to make sure that physicians know accurate, good scientific information. Plus, if they have a question, they can ask a physician and have sort of a one-on-one consultation, if you will. So the Africa CDC provides that service for clinicians if they may have a specific question, and access to experts. Plus, the African expat community are stepping up to the plate, offering their time and talent to help physicians in Africa. In addition, we have a communication network that we're establishing with faith communities so that the leaders of different faiths can have accurate information and be able to convey that information to their population, so to speak. So the Africa CDC has done a fantastic job.
You talk about faith leaders being involved and communicating to populations. When we're talking about Africa, the majority of that population is young. Well over 60% is under 25. How do you communicate the risk to such a population? I know that health crisis communication is something that you also focus on.
Right. Well, actually, we began this Friday with a project funded by the United Nations Development Program that would engage faith-based leaders and also the communication leaders in each one of the national public health institutes, including Sierra Leone. So the leaders of the respective country CDCs have the right information. They're trained in how to develop communication plans, and also the faith-based leaders feel a part of this. So they have the right information. How do we tell our people how to protect themselves? So we provide that service through the Africa CDC.
It's important work that you're doing. You actually were ahead of the curve, getting this effort underway with Dr. Nkengasong, head of Africa CDC. So thank you for the work you're doing. It's needed now more than ever. We're grateful that we have technology, to help bridge the gap to keep this communication going.
For sure. It's the new, as I said, we're moving from Blockbuster to Netflix. We're in Netflix right now.
We are in Netflix. We are. Dr. McNabb, please be safe. Thank you for joining us.
You too. Thank you so much.
Thank you. I want to apologize if you're having audio problems there. We thought we'd push through because, the work that he's doing with Africa CDC is important to share with you, and also to make the point that African leaders at the Africa CDC, this institution that is really sitting at the center of the effort to battle coronavirus on the continent, Africa CDC is not standing still. Africa CDC, you know, from Ebola back in 2014, had started laying this runway to build capacity on the continent so that in the event another crisis turned up, which it has now in the form of coronavirus, that there would be more people, more healthcare professionals able to respond. So, you know, we felt it was important to share that with you and to give you some insight into that training. And where that training stands now, and basically how much has been achieved. So again, apologies for the audio problems, but it was important to persevere. I want to get to your comments now, because you have been writing in, and as I know that we have a big viewership from Sierra Leone, I know that a lot of the comments are indeed about what played out there in the capital earlier today with that prison riot at the Pedemba Road Correctional Facility. They're saying, according to OPAMED, you know, that we have not been able to confirm casualty numbers. Neither did the reporter who just joined us. He only was able to say that an official at the prison was attacked and lost his life, Hassan Kamara. But you're writing in and sharing information, 7 casualties according to government officials. Hindoa Saidu is writing in again, asking about how this all played out in terms of ammunition and tear gas canisters being fired. Again, I'm going to defer to the journalist who was there on the ground. According to that journalist from AYTV, he heard shots himself and tear gas was fired. The question of whether bullets were live or not, that is not something we can confirm at this moment in time, but shots were fired. Even the video that we played at the top of the show, you can clearly hear that shots were fired, and you see the look of panic on the faces of passers-by on the street there who start to run. Suma Abdullahi again writing in, saying, giving more detail, claiming that this information comes from the information minister, Mohammed Rahman Soare, and saying that the 7 who died are 5 prisoners and 2 prison guards. That is what we're getting now, this additional detail that 7 people lost their lives in the disturbance at the prison there in Freetown earlier on Wednesday. That's what is coming out. Again, we continue to follow that for you and to try and get more information. You know, people, Tijan Ibn Mustafa Kalon saying, watching from Italy, thank you, Aisha, for bringing it to us. We encourage every Sierra Leonean to stay calm as the world presently is in a state of oblivion. And I think that's accurate, you know, that there's no doubt that we urge calm. We want to see things calm, and an investigation is underway so we can get fully to the bottom of what happened here, how this started. We need more details, and of course more details of the response on the ground. The 7 people who lost their lives, more detail is needed as to the circumstances and what exactly happened. Also reports that prisoners escaped. You know, we need to get more detail on that. So I just want you to know that we will stay on top of this. And also thank you to everybody who wrote in to say that the audio was problematic. Yes, it was, and my apologies for the audio acting up today, but we are working on making sure that was the end of it. So yes, the situation in Freetown of concern, we're going to follow it for you. Also want to talk to you now about what this means for the economies of the continent. I mean, we know that, you know, globally, everyone is taking the hit. Economies and GDP, gross domestic product, is shrinking. We know that jobs are being lost. Unemployment rates the highest in memory here, in recent memory here in the United States. In Africa also, the fear is that sub-Saharan Africa will slide into recession for the first time in 25 years. That countless jobs will be lost, and people who are already hovering on the edge will be plunged into dire circumstances. We know that the majority of businesses in Africa are in fact small and medium-sized enterprises, and they are feeling this very keenly indeed, this pandemic. I want to bring in a woman who's doing work now to help these small enterprises, help them withstand the shocks that they're facing and hopefully survive this moment. Sandra Locoh joins me now from Nairobi. She is the founder of Finlo, an investment group that has been investing in small and medium-sized enterprises, and in this moment they're stepping up. Sandra, welcome.
Thank you very much. Thanks for having us, Aisha.
It's so good to have you with us. Thank you. Thank you so much. And your audio is perfect. So that makes me joyous. Talk to me about the hit, the businesses you are directly working with, the hit that they are feeling right this moment as this pandemic gets underway in Africa.
Sure. So Finlo is providing capital to small businesses, and by small businesses, we're talking about businesses that are making less than $200,000 in a year in turnover. So these businesses, most of the businesses we're seeing in our pipeline are actually businesses in trade and in like beauty services, spa, small retailers. And so for these businesses, we have seen in the last 2 months, let's say, since mid-March, a real concern in how do I pivot from being an only physical business, which channel is only my shop or my spa or my, my small tailor business. And these people have to pivot from some of them not having a smartphone to doing everything, most of the thing through their phone, or finding people who can deliver their goods and stuff like that. So I'll say that there is two sides of the coin to this pandemic, right? So the good side for some businesses, especially businesses that are selling food, selling stuff that you need in your house, so non-perishable goods, those businesses have been doing quite well by the things in our books. We can see that their revenue is actually growing. Now the other side of the coin is how do they quickly adapt to selling online, using all those social media platforms to be able to sell more and to be able to be present. If we want to talk about, I'm focusing right now in French-speaking African country, West African countries, so mainly Togo, Benin, and Ivory Coast. And we're seeing different trajectory for businesses there because, in those places, businesses are still allowed to be open for certain industries. So if we're talking retail, a retail shop can still be open from 8 to 3:30 p.m. in Togo, for instance. So you still have the ability to sell, but people won't come as they used to, of course. So I'll say that for us, the real issue for our business has been to be able to provide them with digital tools to help them, still be able to grow their sales, and to also provide them with adequate capital, so African source capital, not to burden them with a debt that is labeled in a different currency. I think that's very important for us to be able to source African capital and, most importantly, even domestic capital labeled in the currency of the country in which we're operating. I'll say that has been our biggest challenge to date.
I was going to ask you, how are you faring on that front, getting that local capital, and what more could governments be doing to support these efforts?
Yeah, so I think it's definitely been a challenge to source capital for very small businesses on the continent. I think there were different initiatives that were geared towards probably bigger businesses because they employ more people. But for the very small businesses, there are not a lot of initiative, and right now we are still trying to fund those businesses with Locoh capital, which is a challenge to be honest. There is two needs, right? There is a need for businesses who actually need not capital but free capital because the business has been suppressed. Like if you talk about restaurants, if you talk about hotels, those people don't have any revenues anymore. So debt capital is not going to help them. It's actually going to burden them. So you need actually a public policy for an economic public policy for this specific sector. Now, for the sectors that are still productive and that are still making money, we still need capital, small loans at interest rates that are, of course, affordable to these type of businesses.
You know, as you make clear, some businesses they're being suppressed. There is no business. They cannot operate. What does it mean for the economy? Yes, but I mean for these individuals, their families, their communities. Let's take it down to the personal level. What does it mean for these people if these businesses go under?
Completely. So I'm going to take right here in Kenya the example of one of my friends who owns a restaurant in town, who has closed down, and she has over 10 people that she employs, and those people today are without an income. And unfortunately, we don't have this universal, basic income yet that are, coming to some country in Western countries. These people don't have that. So this is really painful for her to see that, all those people that she has employed for quite a while, trained, and that are now making a living and making their family live out of their living are now without a job. So I think this is where really government needs to focus on. It's really help the people in those sectors and for these companies that have no income anymore. So anyone in hospitality, anyone in restaurant that are not able to basically, delivery homes and things like that, those are the people who really need the help of government in the form of grants. Mm-hmm. Now, there is also productive companies that also need capital, but because everything has slowed down, because everyone is afraid of the future, mm-hmm. no one wants to actually extend needed funding. And that's where Finlo chime in, is that we are today open for business. We currently have a pipeline of like 35 businesses that we have vetted digitally. It's true because we are not able to travel. But these people need debt capital. They're selling. They could be selling more. They could be growing their business. And we feel like it's a bit unfair not to provide them with capital just because people are just afraid of what comes next, right?
Sandra, I do want to apply a gender lens to this and ask about women, and specifically, the brunt that they're taking in this moment when we talk about small businesses. And give me your perspective on what you're seeing.
Sure. So it's great that you're bringing that to the table, because our first loan is actually to a women trader. She sells rice, cooking oil, sugar. She's based out of Leone. And, we tend not to be very aggressive in terms of marketing as women-owned businesses. Small businesses, they're not very aggressive. So no, they're not very visible. But in this time, it's very important for them to be visible, to make sure that their local community, people from the neighborhood buy from them, and they don't need to go all the way down to the wholesaler to buy for them. So I'll say that in this particular time, it's very important for, people to support their local traders. Because most of those local traders are actually women who are also supporting their family and also contributing. So I will say that, we have most of the sectors I was telling you we're supporting are actually women-led, most of them. When I talk about beauty spa, the tailors, the traders, most of them I'm talking about the pipeline we have today, mm-hmm. most of them are women-owned businesses.
Yeah, well, we hope that they can get the debt capital. We hope they can get the relief they need to keep these businesses going, to keep going throughout this, because so many people depend on them, especially when we're talking about women. They sit at the center of keeping homes and communities going. So this is a terrible burden for many women. It's taking a terrible toll on many women and many people as a whole. But there is a gender lens to be applied, particularly when it comes to small businesses. Sandra, Locoh, really appreciate the great insight and perspective you gave. Thank you so much.
Thanks a lot, Isha. Have a great evening.
Thank you. Take care. Stay safe.
Thank you.
again, this is where, from what Sandra was saying, that they need help. They are doing what they can. They have their pipeline. They're supporting their businesses, but some people, it's not debt they need. They need grants to stay alive. There's no business for some people. Restaurants and things like that, spas have shut down. They can't have people there because of social distancing and the need to halt movement. So the governments in across the continent need to figure out how they're going to be able to support these small and medium-sized enterprises. They are the lifeblood of many communities and bolster the economies in many places in Africa. So, again, as we try to get an overview of what's happening on the continent, sometimes we sit at the center and tell you what's happening there, and then sometimes we pull back to get a sense of how it's being viewed from afar and in the diaspora. When I look at this moment for the continent and I see how it's being reflected back to us in the diaspora, it harkens back to things we've seen before, which kind of speak to Africa being, about to fall apart and it being in a calamitous place. Certain old tropes are surfacing once more, becoming more prominent, and it brings to mind what Chimamanda Adichie says about the trouble, the danger of a single story. And we see once more in this moment how in some spaces, as the story of Africa's pandemic is being told, it is once more being boiled down to a single story, a single narrative. We have a great guest next who's joining us now. Claude Grunitzky is joining us. He's a journalist. He's an entrepreneur. He has been watching how this is all being played out, how it's being told. He's the founder of Trace Media and has his own platform, True Africa. He's a great mind, and I'm so pleased he's here to have this conversation with me. Claude, welcome.
Hi, Aisha. It's such a pleasure to be with you on this show, so virtual.
Yeah, I know. I know.
It
is wonderful to have you here because, I've looked through your platform. You're such a deep thinker with so many thoughts on what's happening right now. I want to pick up on this point of the way the story of Africa's pandemic is being told presently. And from where I sit, how it seems to be surfacing some of those old tropes and persistent narratives. What's your thought?
Well, I think that there's a real imbalance in the way that the pandemic is being reported in Western media versus what's actually happening on the continent. Mm-hmm. If we look at the lead stories of, say, the New York Times, the big article they published on April 19th, the lead of the story was, we're in South Sudan, and actually the country has fewer ventilators and they have vice presidents. So they have 5 vice presidents and only 4 ventilators for a country that's about 11 million people. So that's how they pull you in, right? Mm-hmm. And then they're going to show a picture of women kind of social distancing in front of these old huts as if we had no kind of development in Africa over the past century. And it breaks my heart that is still what the prime publications and news outlets are doing, is kind of portraying this very negative image of Africa. And if we actually look at the numbers, it's really bad, but there's only about 35,000 people who actually have had COVID in Africa on the continent so far. And this is a continent of 1.3 billion people. So let's compare the facts and let's try to balance it out a little bit, is what I'm saying when I'm looking at the way it's being reported in the West.
What I find interesting is not just, the media angle of it and how people are, using this lens, this tidal lens of refusing to acknowledge the progress that has been made, but also beyond just kind of the media, the narrative, the telling of the story. Even for me, and I don't know what you make of this, when I look at it, even in terms of like the science and the research, the limited amount that even exists in terms of data into what is happening in Africa, into kind of trying to examine and explain the slow movement of COVID in Africa. It's just not there, almost like a lack of intellectual curiosity into what is happening in this pandemic in Africa.
Yeah, there's a lack of data, that's for sure. And that's because a lot of the governments have been not so transparent in the way they've kind of used this data to attract funding, right? And so we know pretty much what the population of these countries are, but we don't actually know exactly what kind of access they have to healthcare. So then any journalist who's going to usually only go to the capital city, what they'll do is they will extrapolate based on the limited data that is available. And that's why I'm really encouraged when I see initiatives like Google's Data Science Center in Accra, for instance, which is really pulling in real information with respect to how we can use artificial intelligence and machine learning to actually track some of these societal kind of facts that we need to be able to understand where Africa really is right now, because these governments have underinvested in data. And I think that it's going to take a lot of private initiatives from some of these wonderful incubators that we see all over the continent that are actually empowering startups to get the real data that Africa needs. This morning, I was talking to Bosun Tajani, who's the founder and director of CC Hub, which is a wonderful incubator in Lagos and also in Nairobi. And they have wonderful things that they're doing, and they don't actually need the government for any of this. They're doing this as actually empowered citizens collecting real data that is actually getting real information to people all the way down to the last mile communication. So that's the kind of story that I want to read about. And I'm just tired of these journalists kind of getting the shortcuts and simplifying the story just because it makes it more dazzling for Western audiences.
And you made the point that you see this is almost there's a potential here for a turning point for the continent, for entrepreneurs, for innovation, for where Africa sits in kind of a geopolitical order. Explain your thinking.
Well, I'm a bit of an evangelist for technologists, and I really believe in connectivity and the internet and the power to save a lot of people on the continent. And I really want to think about how we can use this crisis and learn from it, learn from some of the mistakes we've made with respect to lack of innovation. And if we just look at an industry that attracted 50% of the venture capital that came into Africa last year, which is the fintech industry. I mean, fintech is a wonderful opportunity to get rid of these cash-based economies right now. Even if we just look at the fact that COVID is transmitted through these bills, these notes that people are carrying, there are so many opportunities through mobile money and what we can do with that. And fintech is one example, but then very linked to fintech is the potential for e-commerce. I was reading about Flutterwave, which is one of Nigeria's best fintechs, and how they are enabling deliveries for Spar, the supermarket, all over Nigeria now. So you can actually buy on your phone and have it delivered all the way to your house. These are new things that we have to experiment with in Africa. It may sound very basic to people living in the West, but if we can use this crisis to accelerate e-commerce through financial technology and other types of innovation, then I'll be such a happy camper.
We all will be a happy camper. Do you see a role for government in accelerating this, or are you seeing this purely happening in the private sector and it being driven by them and individuals? I mean, how do we get to that place? That's the goal, but where does the help need to come from? How do we accelerate that?
I actually look at things in stages. And with respect to a lot of these startups and the innovation that I'm seeing all over the continent, I think that the government should actually get out of the way for these early stage startups. And I think that they have to find friends and family networks and the kinds of VCs that I mentioned to be able to launch their service and get to some sort of proof of concept. And then when they are ready to scale, that's when they can partner with government and development partners. Because every time I've seen government try to empower startups on the continent, it's always failed. Because that's not what they do. They just don't know how risk-taking works from a young entrepreneur's perspective. And so I feel like there's a bit of a Darwinian mode that needs to be implemented all over Africa, where some of the best startups then could be fueled by more VC money, more government money, and more money from some of these institutional partners that have realized that the youth of Africa actually is Africa's biggest asset.
Yeah, absolutely. Absolutely. Claude, such a pleasure. I hope that you'll be a regular and we can have these conversations and take it big picture as to what's happening and the trends and what we need to be keeping an eye on. Claude Grunitzky joining us there from New York. Thank you so much for your insight.
Thank you, Aisha. I really appreciate this.
Thank you. Take care. Be safe out there.
Thank you.
Thank you. I thought that was fascinating. I thought there was so much to learn. And, you know, I want to leave it on that positive note that this is an opportunity. As much as it's difficult and there's loss and there's hardship, there's also the possibility here, the great promise that innovation can help turbocharge Africa's development, and we can surge forward, you know, when this all said and done. That does it for us here today on Home with Isha Sesay. Whether you're watching with me on Facebook or Twitter or on YouTube, thank you for your time. We'll be back tomorrow, same time, same place. Please be safe, everyone. See you again soon. Bye.